Dr. Taralyn McCarrel is an associate professor at the University of Guelph with an extensive background in large animal surgery and a special interest in lameness technology. And today we're going to be discussing equine lameness. Thank you for joining us, Dr. McCarrel.
Thank you for having me.
So, what sparked your interest in pursuing advanced lameness diagnosis?
I mean, my interest in lameness probably started just growing up, riding horses and working at a school and hunter barn. I recognize how important soundness is to the horses at that barn, both for their well-being and also, for the people that are riding them. So I used to, when I would be working in the summertime and bringing the school horses in from outside, I was always like trot them a few steps just to try and pick up if anybody had anything of concern before lessons started. So we didn't accidentally put a horse into a lesson that was having a lameness problem. Now, admittedly, trotting a horse yourself and trying to look at lameness is not ideal, but you work with what you have in the moment.
That's all in the sound, right?
That's actually, I think, one of the most important lessons I learned during my residency, where we did a lot of lameness in race horses.
What are the most common lameness issues you come across?
Yep, so that really varies by what the horses do. I would say, with the exception of race horses, every other category of horse discipline and breed I've worked with, the saying "no foot, no horse" holds true. So the foot still is overwhelmingly the major cause of lameness in the majority of horses. And as I said, the race horses being the exception, and that is also true if you look in the literature. And that may be in part because most of the race horses we're looking at are younger, and foot problems we do tend to see increasing as horses age. So that may be some of a factor in it. So that would be the one exception, I would say. But in general, for everything else, the foot is overwhelmingly the most common area. And then, we'll see, dressage horses, suspensory, hock, stifle. Same with our jumpers, Western performance horses as well. The race horses more going to be fetlock, carcass, suspensory, stifle. But in my world, I would say, well, we still see those cases. Those tend to be managed typically more primarily, or recognized more primarily. So I see a very, I would say, skewed version of what is out there in reality, in that I tend to see lots of feet and then a lot of upper body horses with upper body issues. So neck, back, pelvis. And those may be concurrent with limb lamenesses as well.
What are some of the advanced tools being used in the diagnosis of lameness today?
Yeah, so I mean, I could list just about everything. So I mean, I think everyone knows at this point, MRI was revolutionary for accurately diagnosing causes of lameness in the foot in horses. Interestingly, we still see horses that I call them primary foot pain horses because I don't have a great term for them, but these are horses that consistently block to their feet and have rather unexciting MRIs. And those are some of the most frustrating, because now you don't have a straightforward thing to treat in those cases. Horses that don't have really clear lesions to explain the degree of lameness that they have. Certainly some of them, it's maybe more to do with their the quality of their hoof and the angles that they're on. So digital radiography, the quality of digital radiography has really improved in the last 10 years, I guess. So the cesium iodide plates coming out was a massive change. And so there, field practitioners now can get, some decent x-rays of the back, which in the past you had to come into a referral hospital that had a big overhead unit. The other side of that is in the hospital situation with the big overhead unit, we can now get on many horses very nice x-rays of the vertebral column of the back. And so just the improvement in digital x-ray technology is allowing us to just see more. Another one that I'd say is on the newer side that I got a lot of exposure to at Florida is transrectal ultrasound of the pelvis. So in adult horses, our ability to image the pelvis has been quite limited. Again, the improvement in x-ray technology, we can get a little bit better x-rays of adult horses now standing, but there's still some areas we do not see well. We can do bone scan, but bone scan gives you an idea of an area that's has high bone turnover, but it doesn't tell you what the problem is. It's a good tool to sort of focus your attention on an area, but it doesn't tell you specifically what the problem is. And so ultrasounding the pelvis from inside the rectum, you can actually see much more of the pelvis than we can see from other areas. And if you combine that with ultrasound of the pelvis from the outside as well, you can get, a pretty good view of many things, not everything, but many things. And we actually had some horses that we identified had narrowing of the opening where their nerve comes out at their lumbosacral joint so where their back meets the pelvis. And this is a well-known disease in people and in dogs. So then getting to the newer things. So certainly CT has been, I think when I was a student, there was when all the talk of developing a standing CT was sort of, it goes all the way back to then. And then we had this sort of explosion of different units over a short period of time. And I think at this point now, probably settled on a couple of systems that have emerged as kind of the favorites. But these are, either open or large bore units that we can now get imaging all the way down to the base of the horse's neck, stifle CT. If the horse is small enough, some horses you can CT the pelvis in some of these units. So similar to what MRI, I think, did for the foot, the large bore CTs are doing for the neck. And there's been the recognition of same sort of ideas, the disease I just talked about with the narrowing of the opening for the nerve root in the pelvis. In the neck, this has been recognized on CT. And so a surgical procedure, also CT guided, has been developed to widen that channel. And that's been a game changer from some horses who were, no longer able to perform. In addition to the neck, increased ability to CT the stifle. I think we're going to learn a lot from that. Another condition that I will be interested to see when we have more information is tarsal arthritis. So we know that the amount of pain the horse experiences does not always correlate well with the changes we see on x-rays in the hock. But when you see a CT of a horse with hock arthritis, it is amazing how much the x-rays underestimate all of the changes, because all we see are the changes on the outside rim of the bone, but there's a ton of little joints between all these little bones in the hock. And when you do a CT, you can actually see all the bony change in between all of those little bones. Now, the flip side of that, and where we have to be a little careful, is CT does, when you've had the opportunity to have x-rays and CT on the same horse, you recognize it's so much easier to see things on CT, and it looks so much more dramatic oftentimes, the degree of the changes. And I think we have to be a little careful about jumping to making prognostic determinations now with the information we have now, because all of the published prognosis we have, or most of the published prognosis we have for conditions, are based on radiographic appearance. Another big new one is PET. But what PET does is it gives you information about bone turnover or tissue remodeling. So it is most similar to a bone scan, but they think most people are familiar with bone scans. So that's where we inject a little radioactive molecule in the case of bone scans that goes to bone. And so we get more of that radioactive molecule in bone that's rapidly turning over. With the PET CTs, you can use different markers. The last one, which is not in its infancy, but I would say where CT was many years ago, in that we're hitting this phase where there's a lot of development and new companies coming in developing techniques, is not an imaging modality, which is what basically everything else I've talked about is. It is the gait analysis systems. And this is a super exciting area. So we have had the lameness locator for many, many years now. And certainly that's the system I have the most experience with. And now with AI technology, I think that's why we're starting to see this explosion of development in this area. There's also, of course, in the racehorse world, a lot of interest in being able to use these technologies to better identify and predict horses that might be at risk of having a problem. What we found is, if the horse trots in a nice straight line properly, then the results we would get on the system would be very repeatable. When the horses really act up, the system knows to remove those strides from its calculations. It's when the horse is doing things that are in between that aren't enough to make the system exclude those strides, but are enough to throw off the way that the horse is loading the limbs that can affect the repeatability.
What are some of the exciting new developments in lameness treatments? I know you've been involved in orthobiologics in particular.
On the orthobiologic side, right, so that I'd say the sort of big ones we have are stem cells, or people would argue nowadays maybe more appropriately termed mesenchymal stromal cells, platelet-rich plasma or various other platelet concentrates, IRAP, so interleukin receptor antagonist protein, also known as ACS, and then A2M, which is sort of probably the newest kid on the block in that area. In the platelet concentrate area, we have a variety of options. So there's standard platelet-rich plasma, which in and of itself has a lot of variability in the various systems. Then we have a filter system that is not really PRP because it doesn't have any plasma in it when you get to the end product. Another thing that I think is potentially interesting just from a ease of use standpoint is there's a new shockwave unit coming on the market that is handheld. So, the shockwave units are typically quite large and heavy, and we have a cable running from the machine to the horse. And so it's just a little heavy and awkward. So there is a new shockwave unit that's coming onto the market that is small, light, handheld, and quieter. So that'll be really interesting to see if if people feel like they're getting good results with that from an ease of use standpoint. I think it's going to make people's lives easier. What we really want to see is what is the efficacy of physical therapy for preventing, not just rehabbing horses injury but also from preventing horses from injury. Certainly, those of us who have, I think one of the hardest things with that is the time factor. Having done a back rehab program on my own horse, I understand how difficult it is to actually do it.
What would you consider to be some of the top lameness risk factors?
So we know that age is one of them. Age and body and size. So just bigger horses in general. And then also horses that are overconditioned. So overweight for their size. Certainly we've known for a long time certain what we call developmental orthopedic diseases can contribute to lameness. Hoof care, so good angles in the horse's feet, negative palmar angles where the horse's coffin bone, the heel part of the coffin bone is lower than the toe part of the coffin bone. We know puts excessive stress on the deep digital flexor tendon and the navicular apparatus and the digital cushion, the heel structures of the horse. We know that. Certainly uneven, excessively deep surfaces would be a concern. So footing is important. The last one I should mention is endocrine disease. So we know that horses with Cushing's syndrome or PPID, I guess I should say, and metabolic syndrome are at increased risk of chronic laminitis. And they're not always recognized right away because they don't always present as the classic laminitis description, right? They can just have intermittent lamenesses. So early diagnosis and effective management of those horses is very important. I think it's intuitive that the earlier we identify a small problem and address it, better than dealing with a big problem. So certainly we can see with horses that have sort of lower grade lamenesses that are harder to identify, when those horses then, the sort of complex cases that I will sometimes see, by the time I see them, they have multiple issues. And what's hard to know is, did this horse have one issue that now has caused this other problem, and then this problem, and then this problem? And now you're having to deal with sorting out what all the problems are, what the biggest problem are, and what are compensatory and will take care of themselves if you solve the major problem. So it, of course, would be ideal if we could identify something early when it's subtle and potentially before it impacts a lot of other things. Then there's some more sort of very clear and obvious examples. So from a safety standpoint, early recognition and diagnosis is important. And when I say safety, that's for the horse and for the rider. If we can identify things earlier, we potentially are dealing with a simpler problem, hopefully a shorter period of rest, hopefully a better prognosis.
Thank you very much for these important tips and sharing your expertise.